Hello, I'm Dr. Ariyaratnam. I'm originally from Uduville, South Manipai, and then I done my undergraduate training at the University of Peradeniya, Sri Lanka, and then in 1985 I got an appointment as a visiting lecturer to the University of Manchester. Since then, I am living and working at Manchester, and I am a loyal Manchester citizen at the moment. I'm also a regular visitor to Jaffna, and since 2011 I had a few visits, and I come there to meet my colleagues, relations and my friends. During our recent visits, I also shared my experience and skills with my friends and colleagues in Jaffna Hospital, and also I gained quite a lot of knowledge in treating patients' different conditions with the available resources, and I really gained quite a lot of experience. During our discussions, we also talked about the future of oral health care in the northern part of Sri Lanka. And from the information I gathered, the population at the moment in Jaffna district is 583,378 people. That's according to the census done in 2012. The primary care dentists at the moment, in terms of the numbers, range between 35 and 40, because some of them are going out as on the transfers. The dental specialist service is not that satisfactory. At the moment, we got one dental specialist, orthodontist consultant, and also one visiting specialist or a maxillofacial surgeon. He visits from Bavania once in a month. Then Jaffna also got 6 dental therapists. So in terms of the professional population ratio is quite high. So however, they are doing a fantastic job. The main problems in Jaffna is dental caries and periodontal diseases, oral cancer, and also from my discussion, I also heard about a lot of people suffering from submucous fibrosis, and also the developmental conditions, cleft lip and palate. As I mentioned, even with the very high staff population ratio, the dentists are doing a fantastic job, and they are working hard to meet the demands of the people, and they also work during the difficult times and for their enthusiastic work, and I'm really impressed what the outcomes are. However, the conditions like oral cancer is on the increase, and then it's affecting quite a lot of people, and also like submucous fibrosis is affecting the younger population. I heard even this 9-year-old girl recently in Sri Lanka, she had developed submucous fibrosis. But with the submucous fibrosis, not only it's a potentially malignant condition, but I am more concerned about their quality of life in the future. If they are affected by this particular condition, they develop the problem of difficulty in opening the mouth, because the tissues in the mouth become harder, and they find it very difficult to open the mouth. So that is the biggest problem than the oral cancer, because even younger generation eating a lot of betel nuts, and betel chewing is becoming a common habit in Jaffna for various reasons, and this particular problem is going to be quite major in the future, both in terms of the suffering of the population and in terms of the resources management. And again, we talked about the cleft lip and palate. Again, we had this problem. But the main problem on all of these conditions, even though our professionals are struggling to, are doing a better job to treat this condition, but we don't have any particular informations regarding whether they are going up, the incidence and prevalence are going up, or are we managing properly, or in 10 years time what these particular problems going to be in terms of the number and the severity. So that's why, as I mentioned, even our professionals are struggling to meet the demand. There is a lack of regular sustainable data regarding these particular conditions. So without having that baseline data, it's difficult to forecast what's going to happen in the future, difficult to plan. Also, if you are going to apply for any grants in Sri Lanka or from the international bodies, it's going to be extremely difficult without the baseline data. So in terms of the baseline data, we are far behind the curve. So we need to establish this baseline data before setting up plans in terms of prevention and management in the future. So that is the one aspect of the things at the moment we are missing in Jaffna. The second thing is the oral health education. In terms of oral health education, we have started a continuous professional development program. When I was in 2011 in Jaffna, the group of dentists got together and formed the CPD committee. The CPD committee's main objective is to organize lectures and seminars for the dentist to update their knowledge and skill. And since 2011, they have organized quite a lot of seminars involving the specialists in different specialities in dentistry, like maxillofacial surgery, like orthodontist, like restorative, and so on. And importantly, they also interacted very well with their medical professionals, medical specialists, including cardiologists, dermatologists, pediatrics, and oncologists. So by discussing with them and also inviting to the CPD programs, not only they are gaining knowledge and skill, they are interchanging the knowledge between the dental professionals and the medical professionals. By doing that, I have found within the last 3 years the quality of patients' care improving significantly, which is a great thing happening to Jaffna. And also the CPD committee started a trust fund to get some funding, and that funding is helping them to organize these speakers. In fact, we managed to get a speaker from Manchester, an orthodontist, on a short visit to do a program in Jaffna. And also we recently heard the drug companies recognizing this particular continuous professional development program, and they are quite keen to fund these events. And also the CPD North started a Facebook website. In the future, it will develop into a global communication tool. So the CPD program is going well. On the top of it, there are workshops that have been organized by the Sri Lankan Dental Association and other organizations. So in terms of the updating the knowledge of the dentist and healthcare professional is progressing satisfactorily. The second part of the education is actually the disseminating knowledge and information for the public, because without the public knowing exactly what problems they're having, it's very difficult to manage the problem on the long term. They need to become a partner of our management plans. At the moment, I have seen patients, and I have heard from our friends and relatives, and even people in the educated community or urban community, they still doesn't have much knowledge regarding the link between tobacco, alcohol, and oral cancer. So we need to improve this education. So that's another thing we need to do. And also we are following the guidelines from the different institutions all over the world to treat people in Jaffna. sometimes that may not exactly fit into the management protocol. For that, I think it's a good idea to develop a local guidelines and recommendations to treat and manage or prevent these sort of conditions, which will be more useful. Again, for that, we need to have a structure to do all these things. The third part of thing also is that there are a lot of people like me, and from Sri Lanka, people are doing extremely well globally in different countries, in different specialties, in oral healthcare aspects. And they are very keen to come and interact with the professionals in Sri Lanka, especially in northern region. However, they communicated to me that they haven't got any focal point or anywhere to contact to arrange these trips and how to organize the lectures and interactions. And also for that, we need a body to organize these trips and also inviting these people and then set out a program for them to deliver. And also they can help in screening programs, not only in the urban area but in the village area. All these things we need body to organize these the agenda and programs. So if you look at the different part of Sri Lanka, in Kandy we got a dental school which have a dental public health department on the top of all the specialities, and also they have a dental hospital. So these institutions are helping and organizing like education, the data collection, research and the service. In Colombo there is a dental institute, a giant training center, and also postgraduate institutes. Those structures are coordinating with the Department of Health and Education to give you more knowledge and updates for the professionals as well as the public. And also they have public health dental offices. They are communicating or linking the center to the peripheral. But when you look at other areas in Sri Lanka, we haven't got a structure, oral healthcare structure to achieve these oral health objectives. So that's why when I came back and talked to our friends and the colleagues in Jaffna, and also consultations with the expatriate dental community around the world, we all thought about forming or establishing a structure called Institute of Oral Healthcare Science. It's just a proposal. And also we plan to do this as a pilot program in northern part of Sri Lanka, and if it works well, then we'll be able to roll out this particular project to other parts of Sri Lanka where the oral healthcare institutions are lacking. So this Institute of Oral Healthcare Science probably have three main objectives at present. So this is a structure which is adaptable and also is flexible, and also it is evolvable according to the needs and demands of this particular community. So initially it's have a research arm which mainly involved in data collection and oral diseases, and that will help us to form a baseline data. From that we'll be able to plan the future objectives. And we've got a second arm for education, which is for education for professionals and also the public, and that will continue with the CPD program, and also on to that it will add the public education programs and also add the oral and medical healthcare workers program. And the third arm is the social responsibility. This will coordinate the volunteering resources coming from nationally or internationally and channel it through education, service and research point of view. So these are the three main objectives of the structure. But this particular structure to function, we need to have support from the existing structures in northern part of Sri Lanka. So that's why the particular structure will be University of Jaffna, because we mentioned about organizing collection of baseline data. The public healthcare department of the university is very much significant to this particular part of the function. I already contacted and talked to the senior lecturer and consultant public health, Dr. Surendra Kumar, and he's very keen to become part of this program, and already he started doing dental oral healthcare programs like oral, the betel chewing and this and also betel nut chewing among the different type of population, like younger population, like long distance drivers and so on. So he's already in this particular field, and then he's quite keen to help us. So that's he is, and his department is going to one of the main pillars of this structure. The second pillar will be Department of Health, because the structure initially won't have any manpower. So the manpower we can loan borrow from the Department of Health. The personnel, they are already employed by the Department of Health, like dental surgeons, dental therapists, and so also medical side we have public health inspectors and so on. So if you are doing a screening program or education program, these personnel will interact with the oral healthcare people. So I already talked to the regional dental surgeon, Dr. Balakumar. In fact, he was the first chairman of the CPD committee, and he is very much involved already in our other projects. So he is quite keen to have a support the manpower side in the Department of Health. And he's already coordinating the dental surgeon attending the CPD program and so on. So he knows the mechanism to involve them in the data collection and the education and trust responsibility. The third arm or third pillar will be an international resources, people like us. And for example, I am already attached to the University of Manchester and Central Manchester Foundation Trust. They are already very keen to support the program. They're already supporting my CPD program. So people like me, and there is a professor or pathology linked to Texas University, like that, a clinical director attached to New Zealand University, and so on. There are a lot of people are willing to participate in this project, and they will be coming as international resources. So these three pillars will support this Institute of Oral Healthcare Sciences. So initially, as I mentioned, it will function as a research arm which will collect the data, and the education arm which will help to update the knowledge for the dentist, and also help to disseminate the knowledge among the population. And the third arm is a social responsibility arm, which will coordinate to the international volunteers and national volunteers to do work like in elderly homes or orphanages, where they'll be able to help to screen the children and elderly people for oral healthcare, oral diseases. So this is the structure, and I had the opportunity to discuss about the structure with my colleagues in Jaffna, and they are all very keen to develop this structure further. So as I said, this Institute of Oral Healthcare Science is supported by three structure, and probably will have a governing body to oversee or guide the progress of this particular structure. So the governing body can be the executive body. That's possibly, we think, the Provincial Council, Health Ministry will be able to oversee this program. So I already talked to Dr. Surendra Kumar, and I already talked to Dr. Bala Kumar, and then I also had the opportunity to discuss with their presence with the Health Minister, Honorable Minister Dr. Satyalingam, and then he's also very keen to put this as part of the 10-year program in the future. So I hope this will work well, and as people living outside the country, there are a lot of people willing to help, and also this particular structure will be a complementary structure to the already existing service like Department of Health, and that will support that particular and then strengthen the function of the Department of Health. So that's the program. And then as I said, I was with my colleagues in Jaffna recently in April. They are all very happy. They all understand what the plans are. So I hope this will work, and as I said, the Honourable Minister is already planned to put a 10-year program for the health in Jaffna. I wish him all the best, and thank you.